people who inject drugs are just as deserving of care and compassion as everyone else. Even more so because they've experienced so much trauma and so many hardships in their lives. It's time for them to get a break.
Here on 7th Avenue, right under the sun in Miami, is Florida's pioneering syringe service program, the Idea Exchange, where tools like harm reduction, advocacy, and compassion are being used to save lives. At the intersection, stories of research, compassion, and HIV services for people who use drugs. Caring for people who use drugs.
And so then what has been the difference that you've seen personally from some of the clients coming in, being able to access everything that they need right here?
Well, one, they're happier.
Yeah.
And happiness is a big outcome. We're always talking about viral suppression and things like that, but they're happier because the stigma is profound in the healthcare system. And one thing that I've wanted to do in terms of stigma is it's twofold. So one, I want to protect my patients from the stigma. So I want to keep them here where they will be treated kindly and with the respect they deserve. But then also I want to train the next generation of physicians to treat them kindly when they go out and they practice. So that's the mission.
So if you teach them to have empathy, if you teach them to practice compassion, things that can be taught, the mortality rate of people who inject drugs will decrease. Like, people who inject drugs will live longer because doctors will actually be caring for them.
But people here there's no judgment here. Like here, they don't put you down. They kind of lift you up regardless of your situation.
They just want people to be nice to them, to talk to them, to listen to them, which is something that they don't get often. Throughout the day, up until they get to us on any specific day, they were probably having the worst day of their life.
I've never had a primary doctor that cared about me, but Tookes cares about me. And I asked him, why did he choose to help heroin addicts? And he said, because he didn't like the unjust.
You find those with lived experiences. You deliver all your services through them. So for us here at IDEA, we have Arrow. To me, Arrow epitomizes how successful IDEA could be. And so I think that is very meaningful.
The Idea Exchange, if this place wasn't here, I wouldn't be alive. And several hundred other people wouldn't be alive either. Because of this place, I was introduced to Narcan.
Narcan is an emergency medication that can reverse an opioid overdose.
I've revived 159 people to this day with Narcan, brought them back from overdoses. So, because of Narcan, 159 people are out there right now still living.
We're the people that go through all that stuff. So like, if you've never been through something like that, or like you're starting to go through something like that, these are the people that could actually help you in doing that.
I think that our biggest strength is that we've always included people with lived experience in IDEA. Jose de Lemos, may he rest in peace, who is one of my patients, was the man who greeted you as you walked into IDEA. Jose's presence, and Carlos Franco, may he also rest in peace, our first two peers, they offered us a level of legitimacy that I don't think we would have had otherwise. We really focused in our programming, always having people at the table. So that means not just at the table at IDEA, like, let me run this by you. I mean, in the ivory tower, in the conference room, discussing the grants, discussing the research, discussing any programmatic things that we are considering.
So my message to future doctors, current doctors, all that is to care, to be patient. We have to treat the disease as if it is a disease because that's what we're dealing with.
My advice for future doctors is to listen to their patients. We're just trying to get well or feel better, like however that is.
The people who use our program, the people with substance use disorder, they are the first responders. They are the ones saving the lives. We're just providing the tools. They are the true heroes.
If I could just help one person, then my living is not in vain, baby. Just one. I'm telling you, you can do this.